Welcome to week 5. In this week, we'll talk about the digestive system, and I'll also go through what you should expect for this week's content. All right. So by the end of this series of PowerPoints and video and so on, you should understand these things here. Name most of the digestive organs. Describe the basic functions of the liver, pancreas, gallbladder, and intestines. Identify the liver, stomach, large intestines, and gallbladder on CT scans. Name at least 2 indications for abdominal CT imaging. Now, generally speaking, when someone says they're having an abdominal CAT scan, they mean the abdomen and pelvis. As far as billing, they have to put in both orders. So we'll say abdominal pelvis CT scan. But people would say, the layperson will say, I'm having an abdominal CAT scan. And they mean from the abdomen and pelvis. As a reminder, for CT, we consider the abdomen to be from the diaphragm to the iliac crest, right? And then the pelvis from the iliac crest down through the symphysis pubis. But the layperson will say the entire abdomen includes from the diaphragm all the way through the symphysis pubis. Okay. So we will start with the GI system. Make this larger. And this PowerPoint will be on here. I'll also put something up on Edpuzzle. And you should be able to listen to the audio, but I'm going to talk about it in a different way. I'll show you some examples on CT as we progress through this short PowerPoint here. All right, so what does the GI do? The GI system, that's mainly the organs that have to do with digestion, the processing of food and how it gets disseminated throughout your body so you can get energy. And then waste products are passed out through your digestive system. And that's how you make food and you make waste, right? Through the digestive system. There's some main organs that you should be aware of, and they're accessory organs. Now, the first thing you should know is the difference between these two. The main organs would be the salivary gland, the esophagus, the stomach, the intestines, the rectum, the anus. And these make direct contact with food or play a role in digestion as far as making direct contact with food. So we generally call these the GI tract, generally. The accessory organs are those that don't have direct contact with food. So food doesn't pass through your gallbladder, food doesn't pass through your liver, and food doesn't pass through your pancreas, but they all play a role in digestion, right? So for example, some people would have a sharp pain when they eat certain foods in their gallbladder. That's because the gallbladder stores bile that's created in the liver, and the bile emulsifies fats. So sometimes when you eat certain fatty foods, you'll get pain in your gallbladder as it's trying to, or I don't know if it's struggling, but it's releasing bile to rush to emulsify this fat. There could be something wrong with the gallbladder too. And quite often, doctors just go in and do what's called a cholecystectomy. Cholecystectomy. Let me write this in here temporarily. Cholecystectomy. And what that means is ectomy just means removal of something. And then the doctor will take that out, and then the patient will say, I've had my gallbladder taken out. Right? So the first thing you just learned is that bile is created in the liver and stored in the gallbladder. What's bile do? Bile emulsifies fats, helps to break down fat. The next thing you should know is the pancreas plays many roles, but the most common role, if something's wrong with someone's pancreas, we generally think they have problems with their blood sugar levels. So the pancreas plays a huge role in regulating blood sugar. That's because it secretes hormones that kind of maintains your blood sugar levels. So if something's wrong with someone's pancreas, generally they can develop different types of diabetes. All right, so again, let's review this slide really quickly. We're talking about the GI system that encompasses main organs, as in the GI tract, the organs through which food pass through directly, and the accessory organs that don't make direct contact with food, but they play a role in digestion. And we'll look at some of that on CT in a little bit, right? And this is just a magnified view. You should have done this at some point, either in A&P 1 or 2, or even the early parts of your radiography program. All right, so the bile is created here, stored in the liver, and then secreted into your duodenum, which is the part of the first part of the small intestine, the part that immediately follows the stomach, right? So food will pass through your esophagus, empties into your stomach, and goes to your duodenum, jejunum, then the ileum. And the pancreas here also secretes things into your duodenum. So this actually is called the ampulla of Veda. Ampulla of Vata. Let me write this down. Actually, it's right here. Ampulla of Vata. It's an opening that allows bile and pancreatic juices to flow into the duodenum to help with digestion. So food doesn't pass through your pancreas. Food doesn't pass through here. Food passes through your GI tract. And then these accessory organs, well, they help to digest food. All right, so let's look at some CT images to identify the organs we just spoke about. We're trying to identify the liver, the gallbladder, the stomach, and the pancreas. We'll try to look at the esophagus too as we get to it at some point. All right, so let's look at some of that. And this is a cool website, by the way. I think it's on one of your PowerPoints. Very cool website. We'll move this out the way. And then let's move that out the way. So what we will have here, let me get rid of some of this stuff. Landmarks, deselect all. And then move that over there. All right, so we have 3 planes here. And I talked about planes a couple of weeks ago. But this is the axial plane because it divides the body into superior and inferior sections. So axial scanning or axial planes or axial imaging. And this is the coronal plane or the coronal slices, which it divides the body into anterior and posterior sections. And the sagittal sections, well, they divide the body into right and left sections. So it goes from side to side. You can see that moving here. Why this website is fantastic is, and it's a free website, by the way, is that as it moves, you can see exactly where you are on the corresponding stack of images. So on CT, we get a stack of images, and this is how the radiologist interprets the study. He looks at the whole stack in all 3 sections to classify what he or she thinks is wrong with the patient, right? Just wait for this. Okay, good. All right, so let's identify some stuff here. Let's look at, even though this is a chest, we can still see some stuff. All right, we can look at, if you can guess where the esophagus is. That's the esophagus right there. That's on the axial slice. We can follow it all the way up. That's the esophagus. We're following it down here. So remember, for earlier we talked about atomic number. We said that things with low atomic number show up as black on the image. So you can imagine where there's air, it's going to be black. So that's the trachea, and the esophagus is right behind that. If we look at a 3D image, let me just 3D of chest. If we look at a 3D image of the chest, let's use this one. We can see, let's use this one. We can see that the trachea comes down, but let me see if I could find another one of the esophagus. Esophagus. Okay, this is good. This is good. Let's use this one. All right, so we can see the trachea in front, and you can feel the trachea in the front of your throat, right? And the esophagus is right behind it. And as you swallow, the epiglottis closes up the trachea to prevent food particles from going down the esophagus, right? So you don't aspirate. So the esophagus is behind the trachea or posterior to the trachea. If we look back on this image, it's kind of the same thing. That's the trachea, and this is the that's just behind the trachea. That's the esophagus. We can follow that going down there. Follow that going down there as it empties. You can still see it into the stomach. And that is the stomach, right? You can see the stomach. So you might be wondering, if you're curious or you're not aware, how do we know which side is right, which side is left? Well, by convention, patient, I might have spoken about this before, being examined by doctor. By convention, when you go to see the doctor, they are facing you. So the patient's right side is now on the doctor's left side, vice versa. So it's flipped. So we've kept the imaging convention the same as if you were physically being examined by a doctor. So now when you're viewing the image, the patient's right side is on the left side of the screen. So we know that the liver, let me bring this image back up. We know that the liver is on the right side. The liver is on the right side of the patient. In the anatomical position, that's the right side. So on CT, it's also on the patient's right side, but now it's on our left. Okay. All right. So that's the liver. That's the stomach. We can see air in the stomach right there, and some fluid. And we've now identified the esophagus. You can see it there in the upper part, the lower part of the chest, upper part of the abdomen. We can also see it higher up in the chest, just posterior to the trachea. So we've seen the trachea, we've seen the esophagus, and we've seen now, if we go down lower, we can see the stomach, which is on the left. We can see the liver here on the right. If we move this cursor over here, we can then see it on all three planes. We can see it here on the coronal plane, that's the stomach. We can see it here on the sagittal plane, that's the stomach. And if we scroll across, we can see the same things. If we move, say for example, move to the esophagus higher up, we can see it on all three planes here. That's the esophagus, that's the esophagus. And if we identify then, let's try to find the pancreas. We can see the pancreas here. The pancreas is a funny thing because it's hard to see to the untrained eye for some people, because sometimes it could have atrophied. However, the head of the pancreas is enveloped by the duodenum. The head of the pancreas is enveloped by the duodenum. So you can, this is the head of the pancreas, that's the body, that's the tail. And so the pancreas is wrapped by the duodenum. So what typically happens in CT is we give oral contrast to highlight the duodenum, thereby delineating the head of the pancreas, making it easier for the practitioner to identify the pancreas, right? So you can see parts of the stomach coming around, and this patient's pancreatic head is not easy to identify, but that's the pancreas right here. We can also search on this website. If we just did pancreas, spell that right. Let me see if I could. Pancreas. Let me see if it will show up. Pancreas. Let me put this. Select all. And this identify the pancreas. You know why? Because this is the chest. But let's switch to the abdomen so we can get the abdominal organs now to be the highlight or the primary parts of this stack. Okay, fantastic. So let's now look at the abdomen. That's a pancreas right there. So we can search in here, PANCR, pancreas body. We can see it. And we can see it right there. It's a pancreatic body right there, right? And if we look for the pancreatic, say the tail, it's kind of tricky, but right there, that's a pancreatic tail. All right, so we've identified a bunch of stuff here. We've seen the stomach, we've seen the liver, the different parts of the liver, not so important right now, but they're divided into lobes and quadrants and so on. Don't worry about that right now. Let's say right and left lobe, there's a bunch of quadrants, but don't worry about that right now. So we identified the stomach, we've identified the esophagus, right? We've identified the liver, which is fantastic. The next thing we want to identify is the gallbladder. Now it's on here. Let me give you a clue and see if you could figure this out. Let me bring up the PowerPoint. See if you could figure this out looking at this 3D image. Let me make this larger. And you could see that the gallbladder is tucked underneath the liver right there, right? So if you're scrolling down from superior to inferior, you should get to the gallbladder somewhere tucked in underneath the liver. All right, so see if you could pause the video to identify where on here is the gallbladder. I'll give you a second. And if you were astute enough, you would have figured out that this is the gallbladder right here. That's the gallbladder right here. So bile is created in the liver, stored in the gallbladder, and secreted into the duodenum. Right? So we've identified a bunch of things on here. Bile, created here in the liver. We've identified the liver on CT, stored in the gallbladder, secreted into the duodenum. We've also identified the duodenum that wraps around the head of the pancreas. We also spoke about why we sometimes give oral contrast to patients who are having an abdominal CT. That's because it helps to delineate the head of the pancreas. Right? These two are kind of married together, is how they say it. We also talked about the role of the pancreas. We said that the pancreas helps to regulate blood sugar. We said that bile emulsifies fats, right? Now this is all going to be in the notes here, but it's just to help you to see the CT version of this, right? And we looked at the stomach. We said that the food passes through the digestive tract, and these are accessory organs, the gallbladder, the liver, the pancreas. The food passes through the esophagus, into the stomach, to duodenum, jejunum, ileum, and then to the large intestine, which we'll talk about in a little bit. All right, so let's take one more look at this, and we can see a bunch of organs, but we'll talk about the rest of these in time when we look at other body systems. But this week we're just talking about the digestive system. We'll talk about the kidney and the spleen and some other stuff later on, different muscles and bones and so on, right? But at the very least, when you look at a CT image, you should be able to identify this big thing is the liver. You should also be able to identify this other thing here, closer to the left side, that's the stomach. It's at the top, the superior part of the abdomen, and it typically has air in it, right? And you should also be able to identify that that's the esophagus. If you type in esophagus on this website, esophagus. Maybe it will show it. Yeah, you can see the esophagus kind of going up all the way up here. That's the esophagus right there, right? As it empties into the stomach. All right, awesome. And we can see these on all three planes. Let me move this over here. And let's move this over here and move this out the way. All right, okay, good. This website is so fantastic. So fantastic. I'll show you another thing that you can do with this. So on X-ray, you can window the image to make it look more less contrast or more contrast, so you can see different parts better, right? You can do the same here. So now we're looking at a bone window, and here we're looking at a soft tissue window, which I think is fantastic, absolutely fantastic. You can also deselect all the labels or select all the labels, and if you click on them, so you're really curious. Say when we get to the blood vessels, you want to know what's the aorta do. You click that, you get a short description of what it is. Remember, this is a free tool, you're not being charged for this. All right, let's continue on with the short PowerPoint here. And we'll look at some abnormalities related to the GI system. So I won't point out all of these on CT, but we'll talk about them because you'll typically hear these as indications for having a CT scan. So the first one is a fistula, which is a pretty serious thing. Now, fistula is basically an unnatural tract, or an unnatural connection between two tubular structures, which means whatever is in one cavity is going to escape to the other or escape into an opening, which is terrible. So you can imagine if these food particles, in the case of a tracheoesophageal fistula, meaning a connection between the trachea and the esophagus, now we're going to have food getting into the trachea. Very, very serious, right? Air getting into the esophagus, not so terrible, but so we swallow air all the time, we'll just belch it up. But food getting into the trachea, huge problems. You can imagine now a colorectal fistula or something like that, or other types of terrible examples of this. Why does this happen? It could be some kind of abscess or some kind of degenerative disease. It could be a congenital condition. A congenital condition just means a situation that you're born with, right? Any kind of condition can, there's a myriad of conditions that can cause a fistula. But what is a fistula? It's an unnatural tract, an unnatural opening between two structures or between one structure and another, where the matter that's in one can escape to the other. Terrible, terrible thing to have. Esophageal cancer. Now, cancer is easily identified in most cases of the GI tract because we know what a normal organ will look like on CT. So if it looks abnormal, one of the suspicions they will have is this cancer? Depending on, and we couple that with the patient's signs and symptoms, their clinical indication, right? What do they show up with? Are they having pain? Are they having fevers? Is it an acute condition? Is it chronic? That kind of stuff, right? For those who might be wondering, I think we might have spoken about this before. Chronic just means it's happening over a long period of time, right? Chronic over extended period of time. So the patient has symptoms or signs over a long period of time. Acute, sudden onset. So someone's having chronic pain, they've been having pain for months and months. But if you go to bed tonight and you're completely fine and you wake, so a pain wakes you up, that's acute. It just happened, right? So we couple that and we say, is this patient having, is it a cancer really? And we marry that with the patient's clinical presentation, their signs and symptoms. So esophageal cancer is pretty serious because you can imagine that's how you get your food. You consume food by mastication, which is chewing, and it goes down your esophagus and it gets into your stomach. So esophageal cancer, might wonder to yourself, well, if they can't swallow, what do we do? If you might have guessed, well, we got to have some kind of ostomy, right? Some kind of connection directly into the stomach to pass food, which is terrible because now they won't be able to taste food, which I think is a big part of eating. So they're going to get some kind of feeding tube to not be malnourished. I think I might have some CT image of that. Give me 1 second. Let me minimize that. Beautiful. All right. So they would typically start with X-rays, routine X-ray or some version of that, where they give the patient barium. And so let me see if I could find a CT. Let me see if we could find. Okay. So this patient has. Let me find the axial. Beautiful. So let me make this larger. And you can see all this stuff in here. Now, remember, on the chest, let me find the chest. Let's go back to the chest. And we will look at, if you look at, I'm going to try to make it so it mirrors exactly with this one. So this is right above the aortic arch, right? Right above. Let's go right about there. Notice how clean this looks. You can clearly identify all the structures on here without much soft tissue or anything that looks abnormal. This is a normal looking CT of the chest that shows the esophagus and the trachea and the blood vessels around it. Now, if we look at this thing here, we can see that there's all this soft tissue that doesn't belong there. And this is basically what we're doing as technologists and practitioners. We're looking for what does not belong, right? You're looking for what does not belong. What is different about this? And this is evidence of cancer, some kind of soft tissue or growth that does not belong. You can look at the coronal slices. We can see it here too. Not ideal. These are the long windows. You can still see it there. That does not belong. Right? That's basically what we're doing. We're looking at normal images, and then we're trying to find out what does not look normal. Let's go back to the PowerPoint and then we'll continue on. Achalasia, that just means a narrowing of the esophageal sphincter. There's no cure for this, by the way. So on the left, we can see the normal one. On the right, we can see where it's really narrowed. You can imagine why that's a problem, because if it's narrowed, now we're going to have a dilated esophagus, because the food's going to be backed up here. That's a huge problem, right? There's no cure for this. Hiatus hernia. Now, hiatus hernia, you might have heard about this from X-ray and from fluoroscopy, is just a situation where part of the stomach protrudes above the diaphragm. The word hiatus is an English word. It just means opening or break. In this case, it's an opening in the diaphragm through which the esophagus makes contact with the stomach. So food passes through the diaphragm through the hiatus or the opening, right? So a hiatal hernia is when a part of the stomach goes up through the opening of the diaphragm. So it looks kind of like this. It's a hernia. Hernia just means a protrusion of a structure through an opening where it shouldn't be. It could be an abdominal hernia, inguinal hernia. In this case, it's a hiatal hernia. Hiatal hernia. We can see that easily on fluoroscopy, where we give the patient some kind of contrast to ingest, and we watch them swallow it, or we take a static picture. Not a dynamic, it doesn't have to be dynamic, it could be a static image. We can see where part of the stomach now is above the diaphragm. It shouldn't be here, the diaphragm should be right about there, right? And we can see that also on CT. Now, quite commonly, let me get rid of this one, quite commonly, it's asymptomatic. Asymptomatic, that just means there's no symptoms. So you might go through your whole life and you might have a hiatal hernia. That doesn't mean it's going to cause problems. So your prognosis is good. We talked about prognosis a few weeks ago. Prognosis, or the likely outcome, is good because you probably will live a healthy life, so to speak, with a hiatal hernia. All right. Depending on how severe it is, you can have acid reflux and some other problems, but that doesn't mean you're going to be suspected to have a hiatal hernia sitting at home. So they might have pain for something else, and what will happen is the doctor will arrive at what's called an incidental finding. Incidental finding. Incidental finding. That just means an unexpected discovery that is not related to the original purpose of the exam or test. So do a CAT scan for abdominal pain, lower abdominal pain. And because the abdomen or the upper part of the abdomen is included in the scanning, they will now find, oh no, look at this, they have a hiatal hernia. That doesn't mean they have to be treated. They might suggest some lifestyle changes, but then they will see that the part of the diaphragm, the part of the stomach is now above the diaphragm. So let's see if we could find some other images of that. You can see it here on this image. This is not a CT scan, by the way. It's a fluoroscopy image. Oh, important thing to know, the barium that we use in X-ray is much thicker or much more concentrated than the one that we use in CT. That's all you need to know for right now. If we use the one that we use in X-ray for CT, we're going to get a lot of artifact. All right, and let's look at the coronal image, and this is a pretty exaggerated case of it. We can see all that's above the diaphragm that should not be there. You can see it here on the sagittal images also, right? And even on the long windows, you can see it here, all that's in the chest, it should not be. This is exaggerated, but it can happen. It could also be really, really subtle, but this still doesn't mean the patient has to be treated. See if we could find another example. So here the patient has been given oral contrast for CT, and we have a hiatal hernia. So the contrast is above the diaphragm. It should not be there. That means a part of the stomach is now protruding up into the chest. We can see another example here on this coronal image. And here it is, also a little exaggerated, but you know, it's possible. Possible. All right, let's continue on. And the next condition we'll talk about, you've heard, you can watch this on your own time. What the next condition we'll talk about is diverticulosis or diverticulitis. One is a condition, one's an inflammation. The suffix itis just means inflammation. So you've heard this term before, right? So osis is just a condition of having small pouches called diverticula. So they're not causing any problems, it's just there. But when they start causing problems, it can be serious, because now we can have inflammation and abscesses start to form, and perhaps a perforation or a tear in the lining of the structure, or the colon in this case. So diverticulitis is the inflammation of the diverticula, which is the small pouches that appear on the lining of the colon. We can see it easily on a barium enema study. This is a single contrast barium enema study. And we just take one picture of this is just looks like a supine image. We can see the diverticula all along the tract right there. All along the tract. Now let's see if we could see that on CT. I have some images pulled up here already. And it's pretty straightforward to see, I think. Pretty straightforward to see. If we look at, okay, God, this is actually an angry one that we would recall. So let's first compare this to a normal abdomen. And then we could see what does not look right. So this is, let me try to compare apples to apples here. Let's look at the axial first. The axial stack, and we'll find the axial stack here. Awesome. We'll try to go down. What I'll try to do is put these side by side. Give me 1 second. Side by side. Let me see if I could put this side by side. Beautiful. And then let's try to find, let me put this over here. Let's try to find, here we go. Beautiful. Beautiful. Let me find, here we go. Let's find the axial one. And then we'll try to compare apples to apples here. So we can see we don't see any evidence of diverticula on this image on the left, but on the right, we can see them here. Right? All of these are diverticula. We know if it's inflamed when the fat strands around it there's fat strands around it, then we know it's inflamed. Like this here is diverticulitis. What they would typically do is give antibiotics. In extreme cases, they would have to give, they have to do surgery to resect a part of the colon, right? Let's see if we could find another image, another example of this. Let's find another example of this. Let's find probably let's find a higher one. Let's use this one actually. Let's use this coronal image. And we can see, there we go. We can see the angry bowel, as we would say, this dirty fat all around it, right? And then we can see the diverticula all along the edges of the colon. That's the colon right there, right? And let's find the coronal slices on this one. And you see how much cleaner this looks compared to this one. This person has a huge bladder, by the way, but there's no diverticula to speak of. It looks like normal bowel and air in the bowel, but over here we can see the diverticula all along the sides and even some dirty fat around it, right? We can see some inflammation over here as well in the around the transverse colon. all that's diverticulitis or evidence of diverticulitis. Okay, and then let's continue on with another condition that we can see, and that's bowel obstruction. So in X-ray, we typically do a series with the chest, supine, and erect abdomen. Sometimes the decubitus abdomen. You can see it here. We look for air fluid levels and the horizontal beam X-rays. We can see it there. We can see the dilated bowel loops. That's a hallmark of bowel obstruction. It could be mechanical, meaning something's physically blocking it. Vascular, meaning something's wrong with the vascular supply and causing the bowel not to function properly. Could be neurological, meaning that the nerves, there's a problem with the nerves. It's not innervating properly. There's not enough. The nerves are malfunctioning, so the bowel does not undergo its normal peristaltic movement, right? So what you can go ahead and read this in your own time or listen to the voice prompts that I put here. But let's go ahead and point this out on CT. Let me bring this up once more. Here we go. And let's find small bowel obstruction. Let me bring this on this side and put this here. And we don't see that there's any large bowel loops here, no dilated bowel loops here. But if we look at these examples on the right, get to it in a second, we can clearly see, let me bring up the axial slices over here. We can clearly see the large bowel loops, and that's a hallmark of an obstruction, right? Looks like a child, but it's the same examples abound, right? And let's see if we could find some other ones here. That's X-ray. Okay, this is an adult, so let's try to find this one. We can still see the large bowel loops here, right? You can see them all here. That's the hallmark of a bowel obstruction on CT. All of that's not normal. So let me find the coronal image on this one just to compare these two. So on the left we have normal, which I'm scrolling with right now, and on the right we have an example of intestinal obstruction, right? So intestines nothing's moving as it should, and so it's backed up. All right, let's continue on with I think I have one more example here. Give me 1 second. No, that's the last one. Okay, good. So just to recap, we've looked at the difference between the digestive tract and the accessory organs. We've identified these organs on CT. We've identified the main functions of the pancreas, gallbladder, and liver. We've talked about how food passes through the esophagus, to the stomach, and to the small intestine, to the large intestine. This is a good thing to know, by the way, the passage of food and the order through which it passes through these organs. And we've talked about the location of the gallbladder and the liver on CT. We've talked about some abnormalities that you can commonly see as indications for CT examinations of the abdomen. And we've also spoken about how the layperson would say the abdomen CT scan. Technically, the abdomen for CT we say is from the diaphragm to the iliac crest, and then the pelvis, obviously, we've from the iliac crest through the symphysis pubis. And we would say in CT, with the practitioner, in most cases, I think this is an industry standard, we have to say abdomen and pelvis if we want the diaphragm through the symphysis pubis. All right, but generally speaking, when a layperson said I had an abdominal CAT scan, they mean the entire thing. All right, and that's what we're gonna end here with this PowerPoint and move right into the next PowerPoint, which is kind of like a review of the first. Let me make this smaller and bring this here. Awesome. So as you go through this PowerPoint, I also put notes on these. So it's good for you to take your time and go through this, right? And it's good for you to pause and see if you could answer the questions on your own before you go ahead and read these notes. So I'm gonna hide the notes for now. I'm gonna hide let me see if I could Let me bring this down here, actually. Let's just do this. Let's see if I could. Oh, there you go. Fantastic. So as you go through, try to answer the questions before you go ahead and read these. So for example, the first question here, you can pause the video after each one to answer the questions, right? Oh, what are digestive accessory organs? Right? And questions like this, you gotta try to answer on your own and take notes if you need to. Those will be organs that don't make contact with food directly, but they play a role in digestion. What do you know about bile? Things like that. Where is insulin created and what's its purpose? All important things for you to know. The answers are in the slides, but it's good for you to know. I will move directly on. And so important terms, I mentioned mastication earlier, but this is how it's spelled. What just means chewing. Mastication just means chewing. Peristalsis. This is the contraction and relaxation of tubular structures just to push things along. That happens in your GI tract and also happens in your ureters. But we're speaking of the digestive system now. So we're talking about how food gets through your esophagus and GI system through peristalsis. Regurgitation, things come back up the opposite way from when they should go. Kind of like retrograde, which means against the natural flow of things. But when you regurgitate something, like some animals do, cows do, and so on, food comes up from your stomach up into your sometimes into your esophagus, and maybe all the way up. You can taste the food that you ate maybe a couple of hours ago. It could be a problem. Could just mean you ate too much. Could just be an obstruction. Variety of things. Retrograde just means against a natural flow. Right, so like a retrograde urethrogram, that kind of stuff. And here's another example. We talk a little bit more about the hiatal hernia. Let's move on. I'm not gonna spend a lot of time on here. There's a video on here that's useful for you to watch. It's about deferred pain and how gallstones can sometimes cause pain elsewhere. So what are gallstones? Gallstones are just stones, as the name suggests, or calcifications in your gallbladder. It can be a problem. You've heard about this term before. It can be very, very painful because the gallbladder is still trying to secrete stuff, but it can't really do it properly because, well, there's stones in it. And this video talks about referred pain, I'm sorry. It's really, really good for you to watch. I'm going to let you watch it in your own time. I'm not going to play that here. We talk a little bit more about diverticulosis and diverticulitis. And we talked about obstruction and the treatment of it. And this link here, okay, beautiful. Actually, let me do 9 before I talk about 10. And the idea here is for you to try to guess what the abnormality is. Right, so you can pause the video and try to do it in your own time. The answers are right here, are in the description or in the speaker's notes. All right, so you're gonna try, when you look at this PowerPoint, try to answer the questions in your own time. But that's what this slide is doing. It's saying, what is this condition? We just talked about it maybe a few minutes ago. What's this one? We didn't talk about it, but you can figure it out. And we talked about this one. We talked about this one. All right. So slide 8. Let me pause this. Slide 8 is a wonderful website. Let me make it smaller. A wonderful website. If I can get it to open. Give me 1 second. Let me see if I can get this to open here. It's actually a wonderful website that you can use to practice to label the anatomy. If you open hyperlink, let me open all of them. That shows you a normal CT. And you can just scroll through just like I was doing. It doesn't have the labeling though. That's a normal CT. This is a good 3D anatomy website. I'm going to show you how this works. It's really, really cool. You can go to all the systems. So the respiratory system, the digestive system, so on and so forth. So when you get to the digestive system, you can add layers to identify each structure. You can click on it, read more about the stomach, read more about the gallbladder, that kind of stuff, right? And it's really, really cool. And you can see all the glands up here. Really, really interesting. And you can zoom in, zoom out, right? You can move it around and recenter it. And then it's really, really, really interesting. And the next thing that's on here is where you can practice labeling this stuff. And once you're on the home page, you go to human anatomy and probably just go to abdomen. You can do any one you want, but let's do abdomen. I will do let's do CT series of the abdomen. And let's say you wanted to know where the liver is. You just click it, it shows you. I would suggest just do the bits that we talked about. So don't worry about the IVC just now, but it's good for you to know later on when we're talking about the circulatory system. And then you just get to the next slice and you can do the same thing. And it just tells you really easy what the labels are. See the stomach, and just identifies it for you. Really, really cool. It can do one for the chest also. So if you wanted to see, for example, let's see if it goes to, let's go down even lower. All right, so esophagus has got to be on here. Yeah, that's the esophagus right there, and that's the trachea. So really, really cool stuff. All right, let me go to the next. And I think that's it for this PowerPoint here. Fantastic. Okay, let's head right back now to, let me close all these. Head right back now to the home page. So by the end, you should know all this stuff. After you've listened to this YouTube video and done the ED puzzle, looked at the PowerPoints, you should be able to identify all that, right? All right, take it easy.